Chelsea marks for VETT 222, task 19, which is a cross match, a canine cross match. So we have our supplies here, which is a purple top EDTA, labeled with our patient Misha, and she would be the donor. And dated, we have a 3 ml syringe with a 22 gauge needle on it and some alcohol to prep the site. We're going to zoom in on our patient that's being properly restrained here and get the draw out of that right front cephalic vessel. So I just applied some alcohol to the vessel, palpated, inserting bubble up, and drawing back slowly so we're not getting any hemolysis. And we're going to go ahead and let our assistant lift up and hold off here. Lift up now. Okay, and we're going to insert our sample into our purple top EDTA, letting it suck it in, not applying any pressure. Okay. And there it goes. And we're going to go ahead and take that out and invert 5 to 7 times, mixing that up really good. And again, we have this labeled as Misha, and she is our donor for the cross match. We're going to be doing a jugular blood draw on our patient down here. I'm going to zoom in on our supplies up there that we have collected, which is our bottle of alcohol to prep the site, our blood tubes, which is a purple EDTA tube and a green lithium heparin, and 2 of the 3 cc syringes with a 22 gauge needle on them. I'm going to have Bree restrain here, and we're going to zoom in on our patient. There we go. You're fine. You're fine. Alright, you're okay. Head up. Okay, so just placing a little bit of alcohol on, palpating for the vessel. Okay, inserting the needle bubble up and drawing back slowly so we don't get any hemolysis. Hold off so that we don't have any, doesn't blow, and I'm going to have Bree continue to hold off just for a moment. We're going to fill our tubes here. So we have our purple top. So we have our properly collected samples here, one from patient Kane, who is our recipient, and one from patient Misha, who is our donor. And we have 2 balanced tubes here with the appropriate amount of water to go ahead and centrifuge these. We're going to go ahead and centrifuge, stick them in the centrifuge for about 1,000 times 9 RPMs for about 5 minutes to separate all of that blood away from the red blood cells from the plasma. So I'm going to go ahead and stick in our recipient and stick in our donor along with their respective balance tubes. We're going to go ahead and get that started, set our machine here and on low, and for about 5 minutes we're going to separate out those cells, red blood cells, from the plasma. We'll be back. So the centrifuge just finished, and we're going to go ahead and pull out our samples. So we have sample Misha coming out first, and we're going to go ahead and use a pipette and draw off that plasma from the top of the packed red blood cells, and we're going to put it into a new, fresh, clean, being careful we're not getting any of those red blood cells. We're going to put it into a plain white top tube and label that Misha, donor, and its plasma. We're going to transfer that into that container. Okay, so we have that clearly labeled that that is the donor plasma. Put that in our tray here. And then using a separate pipette, we're going to remove the recipient's tube from the centrifuge. And with a new pipette, we're going to draw off the plasma from that sample as well. Being careful not to get any red blood cells. Okay, and then replace the lid on that. And we're going to put that into Kane, which is the recipient, and plasma. and that's labeled. And transfer that plasma into a plain, no additive white top tube. And put that in our tray here. And we're going to go ahead and take out some of our red blood cells that we have down here, the packed red blood cells. So we're going to use two new pipettes. So we have patient Kane, who is the recipient. So we have, going to remove some of his packed red blood cells. Excuse me. And transfer that into a conical tube. So we have 3 drops of his red blood cells going into that tube. And with a new pipette, we're going to do the same thing for our donor packed red cells, which is Misha. With a new pipette, we're going to remove some of those packed red blood cells. Put that into a conical tube as well. Okay. So we're going to label that conical tube as Misha RBC suspension. And the other one we're going to label as Kane RBC suspension. And this is where we're going to start our washing process, cell washing. So we're going to go ahead and take some, we have some normal saline here hanging. So we're going to go ahead and pour some off into a Dixie cup. So I can use my syringe to draw it up. Okay, so we have that available here, and we're going to go ahead and start the cell washing process, which we're going to do 3 times. So we're going to, we have 3 drops in here of each of the recipient and the donor packed red blood cells. So we're going to use 60 drops of saline, because it's 1 drop of red blood cell to 20 drops of saline. So we're going to go ahead and drop some saline here. And since I put 3 drops in each of these, I'm going to need to use 60 drops of saline. So just count as I go. 4, 5, 6, 7, 8, 10, 11, 12, 13, 14, 15. 20, 21, 22, 23, 25, 26, 27, 28, 29, 30, 31, 32, 33, 34, 35, 36, 37, 38, 39, 40, 41, 42, 43, 45, 46, 47, 48, 49, 50, 51, 52, 53, 54, 55, and 56, 57, 58, 59, 60. Okay, so we have 60 drops of normal saline and 1 drop of red blood cells, and we're going to go ahead and put that in our centrifuge, and that one is labeled Kane. Move our balance tubes here. We're going to do the same thing for patient Misha. So we have 3 drops of her packed red blood cells here, labeled Misha red blood cell suspension. So we're going to add 60 drops of the normal saline, 2, 3, 4, 5, 6, 7, 8, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30, 31, 32, 33, 34, 35, 36, 40, 41, 42, 43, 44, 45, 46, 47, 48, 49, 50, 51, 52, 53, 54, 55, 56, 57, 58, 59, 60. So we have 60 drops of normal saline in Misha and 60 drops of normal saline in Kane and the red blood cell suspension. So that looks good. So we're going to go ahead and put these into the centrifuge here. Okay. So they balance pretty well, so we're just going to use them as their counterbalances. Put that back down in there. And we're going to go ahead and wash those. So we're going to spin those down, resuspend, and draw it off. We're going to do that 3 times, the cell washing process. So we're going to do that once, and then I'll show you how we draw it off and resuspend. So we're going to do that actually 3 separate times, the cell washing. So I'm going to go ahead and put it back into the centrifuge here on low, and we have our 1000 times 9 RPMs just set, and we're going to do that for about another 5 minutes. And they've spun down, and we're going to go ahead, and since we have the conical tubes, we're going to go ahead and just pour off the supernatant here in the garbage can. And we're not disrupting those red blood cells. Okay, so got that poured off. And then the same thing for this one, we're going to go ahead and pour off that. You can also draw it off, so we have these little pipettes, so you can draw it off if you're worried about disturbing the red blood cells in the bottom. Just discard it into the sink or the garbage can here. So this is just the supernatant from washing our red blood cells, so we want to be careful not to disturb them. Okay, so we have that supernatant drawn off again. We're going to go ahead and do the same thing. We're going to wash these for a total of 3 times. So we're going to drop a little bit more saline and use the 5 to 10 mils again, or the 60 drops either way. So we're going to use 5 mils. Okay. And place that in the centrifuge. And for patient Misha, we're going to do the same thing. Resuspend those, add the 5 mils. Make sure they look pretty even, and they do. They match up, so we're going to use them as their own balances in the centrifuge. And we're going to resuspend those for the second time, and that's our second red blood cell washing. So another 2 minutes, and we'll be back when that finishes, and we'll do it one more time. Okay, so we're back for the, just finished the second washing of the red blood cells. We're going to go ahead and remove off the supernatant one more time. So I'm just going to draw it off with a pipette here and pour it into the garbage. I'll show you what we're doing down here. So I'm just taking my clean pipette and drawing off that supernatant and discarding it. We're going to be careful not to touch those packed red blood cells down in the bottom. So we're going to need those. Okay, so that's drawn off. And you can see just the red blood cells are left packed in the bottom. And we're going to do the same thing with a new pipette for patient Misha. So we have her sample here that we're going to draw off the supernatant. Again, you could use this conical tube and just pour it off, but I don't want to disturb these packed red blood cells down on the bottom, so I'm just going to use the pipette. Okay, so we have those all drawn up and just the packed red blood cells remain. So for the third washing of the red blood cells, we're going to go ahead and add, again, 5 to 10 mils of our saline, normal saline here that we have in our cup, using our syringe. So we're just going to add that. Perfect. So we have that, and we're going to resuspend that in the centrifuge one more time. So I'm going to drop another 5 mils for our Misha's sample. Okay. And make sure that they balance out again, and they do. So I'm going to show you that they balance, and we're going to put those in the centrifuge. That up a little. Okay, so they counterbalance themselves, and we're going to set that up for another 2 minutes, and spin that down one more time to complete the cell washing process. Okay, so we've just finished our centrifuge for the third time of the cell washing process. So we're going to take those out, and one more time we're going to draw off the supernatant and discard into the garbage. Being careful not to disturb those red blood cells that are now washed and packed in the bottom. I'm going to use those in just a moment. Okay. Drawing off the last little bit here. Not disturbing the red blood cells in the bottom. Okay, so we have patient Misha's red blood cells that have been washed. We're going to use a new pipette and draw up 1 drop of the washed red blood cells. and place it in a new tube labeled Misha Donor Red Blood Cell Suspension. So to make a 3 to 5% red blood cell suspension, we're going to add 1 drop of Misha's packed red blood cells. Okay. And we're going to add 20 drops of the normal saline that we have here. So let me count here. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 15, 16, 17, 18, 19, 20. Okay, so we have now Misha's, the donor's red blood cell suspension, 3 to 5% suspension. And we're going to do the same thing with a new pipette for Kane, which is the recipient. We have his washed cells that we're going to draw off the supernatant one more time. Okay, so now that we have those drawn off, we're going to take 1 drop of these patient Kane's washed red blood cells and add it to the tube that says Kane recipient red blood cell solution. So we're going to make his 3 to 5% red blood cell solution. So we're going to add 1 drop of the packed red blood cells to this tube that we labeled red blood cell suspension. So we have 1 drop there. And then we're going to add with a new pipette 20 drops of the normal saline that we have down here on the counter. So I just picked up our normal saline from here with a new pipette. So we're going to do 20 drops of normal saline. 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 18, 19, 20. Okay. And recap that. So now we have Kane, and it's the recipient 3 to 5% red blood cell solution with the normal saline and the washed red blood cells. Okay, so we're back to perform our cross match. We have our samples ready. We have our recipient plasma, which is patient Kane. We have our donor plasma, which is patient Misha. I want to take note here that Kane's blood, it has a little bit of hemolysis, and Misha's looks nice and clear. That's the plasma. And then we have Misha, which is our donor, red blood cell solution here, our 3 to 5% red blood cell solution. And Kane, the recipient, we have his red blood cell solution. So we're going to go ahead and use those to perform our cross match. So we have some other tubes labeled here to perform that. So we have a major cross-match tube, which would be the recipient plasma and the donor washed red blood cells. We have the minor cross-match, which is the donor plasma and the recipient's washed red blood cells. And we have a recipient control, which is the recipient's washed red blood cells and the recipient's plasma. So we're going to go ahead and perform the major cross-match first. It's going to be 2 parts plasma to 1 part of the red blood cell suspension. So we have some pipettes here. First one we're going to do is the major. So you want to take the recipient plasma. Okay. 2 parts recipient plasma. And do 2 drops. 1, 2. To 1 part of the donor washed red blood cell solution, the new pipette. So 1 drop of that. Okay. So that is our major cross match, and we're going to gently mix that, and we're going to wait for that 15 minutes. That one's going to just incubate at room temperature, so we'll come back to that. Next we're going to do the minor cross match here, which is the donor plasma, which is patient Misha. Is our donor. So we're going to do 2 parts plasma. So we're going to use 2 drops. So again, this is our minor cross match. So this is 2 drops of the donor plasma. 1, 2. To 1 drop of the recipient's washed red blood cell solution. So we have that here. We're going to use a new pipette and drop 1 drop of that recipient washed red blood cell solution. And that's going to go in this minor cross match. So 1 drop into there. Okay. And mix those, gently invert. And we're going to incubate that for 15 minutes. Looks like a little hemolysis there. So that one's going to sit and incubate as well. And then we have our recipient control. So we're going to use recipient plasma here. 2 parts of that, so 2 drops of recipient plasma. 1, 2. Oops. 2. Okay. And a new pipette here, and we're going to use 1 drop of the recipient red blood cell solution. So 2 parts to 1 part. And that is going to be mixed gently and inverted, and we're going to watch that for another 15 minutes. That's going to sit and incubate at room temperature, and then we're going to come back and look for the macroscopic agglutination as well as microscopic on our microscope. Okay, so we're back filming. We finished 15 minutes of incubation, so we have our 3 samples here, our minor, our major, and our control cross matches. And we have a balance tube. So these 2 balance each other out. This one's going to require a balance tube, so we're going to go ahead and centrifuge those for 15 seconds at the 1000 times 9 RPM. Put those in there. We have them all labeled. Okay, so now that they're in there and they're secure, we're going to go ahead and centrifuge at that 1000 times 9 RPM. So set that low, and it's only 15 seconds, so we're just going to time it. So the next step is we're going to view each of the samples for any hemolysis. The supernatant, we're going to examine that. So we have, this is the minor cross match. And it does look like there is some hemolysis of our supernatant. I'm going to set this up here and get ready for the microscopic review as well. So we have our major cross match, and that looks like maybe slight hemolysis, not a lot. So that was our major. And we're going to pull off, this is just the balance tube that I had, and we're pulling out our recipient control, and it looks like there is hemolysis on the top of that sample, so that's the control. Okay. So we're going to shut off that centrifuge, we're going to resuspend these cells, and we're going to look at them microscopically as well. So I'm going to grab some microscope slides. I do have one actually right here. So we're resuspending our cells, and we're going to look for microscopic agglutination. So we have our recipient control here. We don't need that one first. We're going to use our major cross match. So we're going to resuspend and use a fresh pipette here. Place 1 drop on our slide. We're going to label that major. And we're going to label the other tube here, resuspend it gently. Use a new pipette and draw off a drop and put that on the minor slide. Okay, put that back down. Okay, so you can see what I was doing down here. So I have one slide labeled major, I have one slide labeled minor. And we're going to go over to our microscope and evaluate for agglutination. Examine our 3 samples microscopically as well as macroscopically. So we have our 3 samples here in our tray. First one we're going to look at is our recipient control. So it looks like there is a little bit of hemolysis there. And I'm going to go ahead and resuspend and look for any agglutination. And I'm not seeing any. So we have 1 drop of our recipient control that we're going to put on a slide here. And we're going to view it microscopically now. So that is our recipient control. We're going to be looking for microscopic agglutination. Alright, so we're going to show that. Just getting focused in here and adjusting the light and the oculars. Okay, so we can look down on the 40x. I'm going to go back to the 10 for a second. Okay, so we're focused in one more time. And we're going to take a look for any microscopic agglutination. So you can view that on the low power field. And I'm going to adjust the lens down here on the iris. Okay. So on the 40x we're looking for agglutination. And I'm not seeing any. The red blood cells are all just floating around, not really clumped up. So I'll show you a picture of what we're looking for as far as agglutination goes on the computer here in just a second. So the recipient control looks good. So the next one we're going to evaluate is our, so that's the recipient control there. And we have 1 drop of our minor cross-match that we've put on a slide. And right now I'm going to take a look for microscopic agglutination and hemolysis and resuspend that. Okay, so I'm not seeing any agglutination, just some slight hemolysis. So we have 1 drop of that minor cross-match on a slide here, and I'm going to put a cover slip over that and take a look at it microscopically. So that is our that is our minor cross-match. Okay. So I'm just going to get focused in here first and adjust the light. That down. Okay, so on the 10x we can look for some agglutination. And I am seeing microscopic agglutination for the minor cross-match. Yeah, so there is a pretty fair amount of microscopic agglutination happening for this minor cross-match. Okay, and the last one we're going to look at here is our major. Okay, so we have our major here, and I am seeing some hemolysis, as well as maybe a touch of agglutination down in the bottom, a little plug that's kind of happening. So I'm going to resuspend that and take a look at that one more time. Okay, and the same thing is kind of happening where we're having a little hemolysis and a small amount of macroscopic agglutination. So we're going to have one drop of that major crossmatch here on the slide. Two overslips there. So the major, we're going to add one more drop since I kind of messed that up just now. Okay, so one drop of the major on the slide there so that we can microscopically view and look for that agglutination. So it's back on the microscope. Okay, again, just focusing in. Okay, and on this one as well, I'm also seeing some microscopic agglutination, which is that clumping of those red blood cells together when they are not a match. So from what we've found here today, there's quite a bit. There's some. What we found today, these two patients are not compatible matches. So patient Kane and patient Misha are not a match, and we would have to continue this process with another patient to try to find Kane a donor. So I'm going to go over to the computer and show you what we were looking for here on the microscope, which was the microscopic agglutination. Okay, so there's some red blood cells there all clumped together. So that is more agglutination, indicating that the patient is not a cross-match. So we're going to go ahead and head over to the patient's chart here and input that information into Misha and Kane's records. So in Misha's right now, so what I saw for hers was slight hemolysis and some agglutination during minor as well as major cross-matching. So indicating that Misha and Kane are not acceptable blood matches. And we would have to continue the process and try to find Kane a different donor. But it looks like I have it here recorded in the chart, so slight hemolysis and some agglutination during minor as well as major cross-matching. Let's add that it was macroscopic as well as microscopic, indicating that Misha and Kane are not acceptable matches. So we will, if we wanted to go ahead and find a donor for Kane, we would have to keep trying. So that was a cross match and a canine.